Well, it's not uncommon for women to have a breast reduction. In fact, it's surgery many talk about openly. It's also not uncommon for men to have the procedure done. A major difference, though, most guys aren't owning up under the knife for this one. CTV's Kyle Christie is here with this very interesting story. Kyle, this isn't something you hear about every day.
No, it really isn't, but gynecomastia surgery, as it's called, is relatively common. The doctor you are about to meet performs the surgery at least once a week. Some people say, why don't these guys just lose weight? Well, often it is not simple. In fact, some possible causes of large breasts on men may surprise you.
My father opened his shirt.
Yeah, and?
Tell him, Kramer.
He had breasts.
It may have been funny on Seinfeld, but in real life, few men laugh at having breasts.
Just having a conversation, someone looks at your chest, you're like, God, is he wondering if I have breasts?
And he did have large breasts. This is what Jay, who doesn't want to be identified, used to look like. Now, after undergoing gynecomastia surgery, a dramatic difference. This cosmetic surgeon in Waterloo performs breast reduction surgery on 4 to 6 times a month.
Some guys have huge breasts. I mean, I have some male patients that come to me for this procedure that have bigger breasts than some of the women I see for breast implants.
Although weight gain can cause the size of a man's breast to increase, growth can also be a sign of something much more serious, or the reaction types of drug use.
So you can have a pituitary tumor in your brain, or a problem with hormone levels from a testicular tumor that can cause gynecomastia. There are a whole host of drugs that can cause gynecomastia. One of the more common things that people don't realize is smoking marijuana has been associated with gynecomastia.
Procedure takes anywhere from 60 to 90 minutes. As for recovery, that's around 4 to 6 days. The cost, men can expect to pay anywhere from $4,000 to $6,000. And here's how it works. After testing to make sure a major medical condition is not the cause, a small incision is made on the side of a man's chest.
There's a couple of very specialized instruments to free up that breast tissue from the surrounding skin, and then I gently tease it out through that tiny little incision.
Left behind is a tiny scar. Jay is pleased with the results.
Most people say you've lost weight because it really changes your body contour.
And he won't be needing one of these.
A bra is for ladies. Meet the bro.
On a serious note, though, as with any surgery, there are risks involved, and it's recommended anyone considering this deals with a board-certified plastic surgeon, such as Dr. Shanker. He is a board-certified plastic surgeon as well as a cosmetic surgeon, not just a cosmetic surgeon. You want to make sure they have that certification. Janine.
Okay, Kyle. Well, you know, guys might not want to talk about this. There's probably some other procedures they're having done, whether or not they want to talk about it.
Well, Dr. Shanker says more men in general are having plastic surgery. The most popular procedures are eyelids, abdominal liposuction, and facelifts. They're getting non-surgical things done like Botox and laser resurfacing. Times they are a-changing, as they say, Janine.